Welcome back, everybody. It is National Diabetes Heart Connection Day. According to the American College of Cardiology, 30 million adults in our country have diabetes, and diabetics are more prone to silent heart attacks.
Yeah, and the key is silent because there are often no symptoms, but they can be prevented. So Dr. Ahmed Ansari, interventional cardiologist with Memorial Hermann, joins us more to talk more about, these silent heart attacks. What are they, and how do we know if we're experiencing it?
So with a heart attack, you can have a wide variety of symptoms. So you can have typical symptoms, atypical symptoms, and a silent heart attack. So in a typical symptoms, you have the classic, chest pain, feels like an elephant sitting on your chest. You can have radiation to your left arm, to your jaw, shortness of breath, sweating, nausea. Those are what your typical symptoms are. Atypical symptoms are similar to those non-specific symptoms, except that you may lack you'll lack the typical chest pain. With silent heart attacks, patients can have a wide variety of non-specific symptoms. They can have like shoulder pain. They may have no symptoms at all, or they just may present to the hospital with feeling fatigue or just not feeling well at all.
Why are diabetics more prone to having these silent heart attacks?
Yes, that's an excellent question. So unfortunately, patients who have long-standing diabetes can develop damage to the nervous system, and the nervous system is a mechanism by which pain is felt. And so if there's impairment of the nervous system, you just don't feel the pain.
Well, how long can this go undetected, and what can you do to prevent a silent heart attack?
Well, preventing a silent heart attack is like preventing any other type of heart attack. It's all about the risk factors, so knowing your family history and making sure you get screened. If you're diabetic, making sure your diabetes is well controlled. If you have high blood pressure, making sure your blood pressure is controlled, making sure you're on adequate medication for cholesterol. If you have elevated cholesterol, making sure that you have a healthy lifestyle, including diet and exercise. The American Heart Association recommends walking at least 30 minutes 5 times a week.
And while I hear you talking about all of those to help your heart, a lot on that list are the same ones that you can do to prevent diabetes before it happens. Well, it's all about that healthy lifestyle.
Exactly. Unfortunately, diabetes has a very strong people who are diabetic have a very strong predisposition to developing not only heart disease, they can develop strokes, they can develop peripheral arterial disease, and it's all about managing the risk factors. And the main thing is weight. Being overweight increases your risk of diabetes multiple-fold, and your weight, lifestyle, diet, exercise, avoiding refined sugars and carbohydrates.
For sure. And you also offer diabetes self-management classes, covering healthy eating as well and being active.
Yes, at our campus at Memorial Hermann Southwest, we do have a class that does provide that. And you can see our website and contact us to get enrolled in that class.
Yeah, and how helpful is that? Is that for somebody who is already in the depths of diabetes, or who would benefit from that class?
Yeah, anybody who has been diagnosed with diabetes would definitely benefit from that class. It helps teach on dietary changes that you can make, other lifestyle changes, how to manage your sugar and when to check it, and issues that you can have with medications and so forth.
And that's at Memorial Hermann Southwest.
Southwest, yes.
Make sure we get that right.
Yes, all right. And you can find that information at memorialhermann.org services and click on diabetes there. All right, thank you so much.
No problem. Thank you for having me.